Hello everyone, how are you all? I hope you would be fine. This is Sidra Kashif representing MSK Linguistics Center from Pakistan, Karachi. Being an EFL or IELTS instructor plus founder and moderator, as most of you know that I do invite multiple foreigners, educationists or professionals to my live podcast and we discuss about their expertise or the relevant topic which we find really interesting or useful to all of you. So today we have Dr. Rehan Yaqoob, an expert AI trainer, AI mentor who is an emergency physician and scientific writing mentor. We are going to discuss about the topic AI 360. AI stands for artificial intelligence. So in that topic, we would discuss about health, education, and advancement. Whether you are an educationist, a learner, or an entrepreneur, this live podcast is going to be really beneficial to all of you if you are connected till the end. So let's get started. Hello, sir. Warm welcome to you. Good evening.
Uh, Hello and good evening, and thank you for the opportunity to have my views at your podcast.
My pleasure. Sir, the introduction which I have given to my audience, I think it's not that quite sufficient. You could elaborate about you very well. So
Okay,
I would like you to introduce yourself.
okay. So I'm Dr. Rehan Yaqoob, and I graduated from National Medical University. After passing my MBBS, I have a lot of experience taking care of patients in emergency medicine and critical care. Over the last 2 years, with the advent of AI, it's been now 2.5 years almost. I got interest in artificial intelligence integration in healthcare. So, from the last 2.5 years, I have been conducting online and on-site workshops, training specifically healthcare professionals on the use of artificial intelligence. Apart from this, I conducted a few workshops to train medical educationists as well, uh, to take artificial intelligence as an assistant in their teaching. And I also help medical students how to harness AI in everyday life.
Hmm.
So this is a brief about me. Apart from that, I am a scientific writing mentor. I have almost 11 publications in well-accredited journals, and my sole purpose is to basically train healthcare professionals, because as healthcare professionals we are not that much tech savvy. So my main purpose is to bridge the gap between technology and our healthcare jobs.
Interesting. Really appreciated. And it's our pleasure to have you to discuss about the topic which is really aligned with your expertise, experience, or qualifications. It's our honor to
Thank
have
you.
you.
Actually, it's my
And
pleasure to have me on this forum.
I hope that our audience would get something useful from this podcast because of you.
Yes, hopefully, I will try to bring my insights regarding artificial intelligence. And actually, there is a lot of, whenever there is new technology, there is a fear among people as well to use the technology or not. So I hope I will bridge that gap to use it as ethically and logically.
That's great. Okay, sir. I have designed few questions as per the topic. Shall I ask you if you allow me?
Yes, yes, you can proceed.
Thank you so much. Okay. So first question is all about that what are the advantages or disadvantages of AI and what which tools are essential to be familiar with in this era?
Actually, artificial intelligence, like it has diverse functionalities. Now, whether you are a medical student or whether you are a student, it can be as a peer along with you to assist you during your education. Or if you are a healthcare professional, it can make some laborious tasks more easy. Apart from that, in research work, scientific research, clinical research, medical writing, it can ease uh, the journey and it will make it more streamlined and efficient. Apart from that, if you talk about financial perspectives, there are a lot of things that AI will work on and make it more streamlined. And apart from that, like a few technical things it will implement that will make the things more fruitful and more beneficial for human beings.
Yeah,
So
obviously there
regarding the
are
second part
advantages
of your
or
question,
disadvantages, both of them.
yeah, regarding the disadvantages, uh, whenever I uh, take sessions on AI and its use in scientific research and its integration in healthcare, I mostly talk about that don't have an over reliance on AI tools. Maintain your critical thinking. So use artificial intelligence as an assistant along with you. I mostly talk about it, take it like as an undergraduate student who is keen and eager to learn along with you. So take it along with you. It will help you in assistance, but don't over rely on AI. Over reliance on AI will lead to certain things that may not be right at the moment, that may not be ethical as well. Second thing is the major disadvantage nowadays is of creation of the fake content. Now, very soon, I think the governments will and the platforms itself. Now, recently I came across the YouTube policy that it has on its content. It has made it necessary that there will be some part will be humanly generated. If the majority of the content is AI generated, it will not allow to post, or even if you post, it will not lead to monetization or propagation. Second thing is about the fake content and the fake videos. These are the major hurdles, and the propagation of fake materials. This is the major thing, which is where AI has disadvantage. Now, it's our responsibility as a human being to take care of it, to use it ethically. Now, it's basically a responsibility on each and every one. After that, if uh, the governance model may implement certain laws may be implemented by certain organization firms, which will make it more ethical to use. And I think in the coming years, this may happen, and then we will be talking about more of its advantages and less of its disadvantages because it will be more streamlined. Regarding the second part of your question, that what are the AI tools which are needed to be necessary? Now, since the advent of AI, there is actually a rat race between major corporate firms to bring the models, update them each and every day because they are trained on a set of data, and these data is continuously being replenished. So what I think is the large language models, a few of the large language models which are more essential. One is first one is Gemini, then Claude and ChatGPT. These are the thing. At least everyone must have the basic understanding of it, how to communicate with these large language models. Second thing is there is a free tool by Google that is Notebook LM that is very much helpful for the people working in education sector and also for the healthcare professionals. Certain other professions may also benefit of it because of its research and deep research capabilities. So these two or three large language models along with Notebook LM, that is a source grounded form of a large language model. These are the most essential tools to at least have an idea how to communicate with these large language models.
Hmm. Definitely, if there are advantages, so there are the disadvantages as well. If we talk about advantages, so It is really easy to do your task in very short time by the help or assistance of AI. If we use it effectively, if uh, uh, if we don't have knowledge that how to use it, so that is indeed really harmful. And AI needs suggestions or instructions by human. These are humans, those run AI. It doesn't use its brain, but it takes data from Google or other apps, that is multiple collection, which is assembled by AI. And you know that the informations which are shared by the people on Google or apps that not authentic. So if we know, if we are familiar with it, there are number of benefits. Otherwise, it is harmful. Number of times, educationists or health professionals or professionals, they do the correction of AI if they know, if they do have experience or according to their qualification. If we talk
Yeah.
about the tools as you have elaborated, like Notebook L or Gemini, or if we talk about Chat GPT, so the information which we gain, that is not that much fruitful if our enrollment is not there. Our enrollment or our knowledge is really mandatory by using it.
Yes, you are right. I will second your opinion. So actually, we don't have to use these models as our supervisors. We need to take them as assistant, and actually we need to train them according to our insight and our judgment and critical thinking. So these are the major cornerstones of how to use these large language models. So if we are not using it according to our critical thinking, then there are chances that it may be dangerous to us, or it may produce some harmful content as well if we rely on each and everything with the large language models. So human insight is more important, and especially uh, the critical thinking part. So we must use these AI tools as our collaborators rather than supervisors, and we need to maintain our critical thinking. We need to put our insights, and even if we are using it for some sort of content or research, we need to verify that as well. So
Yeah.
if we re-verify it and we use it according to our critical thinking, then it's a pretty better thing that you have an insight already you have. Then you collaborate with the large language models, you verify the information, and then you come up for a new insight that is basically a collaboration between a human critical thinking and an AI model. Because these large language models, whatever these are, whether they are softwares, whether they are tools, they train on a particular set of data. So once we have collaborated with it, then only we can say that its use is logical or ethical or not. Taking into consideration its role in specifically in healthcare, the human in the loop thing is the one that will be most important, because whenever we are talking about healthcare, we are dealing with human beings, and we need to maintain an insight how to make the things more efficient rather than to make more cumbersome.
Yeah, I couldn't agree more with your point, as you said that it needs proofreading as well. So if a person is qualified or experienced, he would sort it out, and like if we need something according to our need or requirement, sometimes AI provides much details. Every detail is not necessary. This is the human, this is the professional or educationist who should have knowledge relevant to it, that how to instruct it, how to run it.
Yes,
This is
definitely.
how
That's why I am
and this
saying that
make it
once.
interesting as
Yeah. Yes, definitely. This is what I am saying, that if we need to learn to communicate with these large language models, then we can have a better insight how to use them more logically. And in that way, the output that is being generated by these tools and these large language models, they are more refined as well.
well. Right. You have elaborated very well according to the questions. I hope that you have explained it by considering all of the points. So let's move towards another question. Okay.
Yes.
What makes AI credible now that couldn't have been recognized or introduced before?
Okay. So actually, AI was in our life for a long time, but we were not aware of. Like for how long in most of my training sessions I ask participants for how long you are using navigational maps, Google Maps, Netflix. Majority of times we have seen that we see one movie, next day when we open Netflix, the similar kind of suggestions of movies, they come in front of us. Similar is the case with Facebook navigational maps. Like navigation maps are for long time with us. Then once you open your iPhone, the iPhone has the first one, which is embedded the face recognition. So you just put your iPhone in front of your face and it immediately get unlocked. So we were using AI, but we were not aware of. Secondly, with the advent of like with the COVID era, there are a lot of digital transformation in each and every sector of life, from business to education to healthcare. So with the advent of that digital transformation, AI come into more highlight. So it was in the background, but then it comes to the forefront, and then we are more aware of it, that how we are using these artificial intelligence previously as well. So we were using it for a long time, but after the digital transformation, it becomes more prominent. And with the advent of these large language models, it was more obvious. ChatGPT came. I remember the time when ChatGPT came. One of my student, she introduced me, and she was saying that, "Are you aware of ChatGPT?" I said, "I haven't listened about it." So she said that yes, this is good for people who are working in clinical and educational field as well. It makes schedules. The day I went back and I just tried to like explore it, but it has gone refinements, but still it is not 100% reliable.
Yeah, right. It's 40 to
Second,
50% okay, but
yeah,
50% human enrollment is mandatory to guide
yes,
or instruct
human,
it
yeah,
according to
hu-
knowledge or
human
awareness.
human insight is necessary for that. There's a lot of hype, like every day when you open the LinkedIn, you will see that these much number of jobs have been taken off. Yes, these are taken off because the AI models are being developed. So AI will not replace humans, but those who will learn and train with AI, then they will going to replace. So I don't think so. Like if AI will be at a point, we are seeing such thing from the last 2.5 years. Still at this point, it has not been that much efficient that it will uh, ca- take whole over of the jobs of the humans. So anyone with AI will take over maybe in the future, but still there is a lot of hype, I can say, regarding these AI tools.
Yeah, right. Before we were introduced as there were technologies like washing machine, computer, refrigerator. It would run by a human, no? A human would operate that. But if we talk about AI, so people say that it has brain and it recommends us or suggests us the things. So that is really useful to be aware
Yeah.
about it. Na? So we need to use it to be operator of it, not to rely on it.
Yes, not to 100% reliant, because sometimes it gives that much false information. And the best thing is that the AI is very confident. When you prompt it that this thing is not correct, it will very it will accept its mistake as well very confidently, that okay,
Yeah.
yes, this is wrong now. So this means that we need to interact with these models to come up at a point that how to tailor these artificial intelligence tools according to our need and our critical thinking.
Being an educationist or EFL or IELTS trainer, most of the times I find grammatical mistakes in it. Now, so whenever I point it out, then it says, "Oh, sorry, it is like that or that." It makes you fool sometimes.
Yes, yes, that is actually for educationists, it can be used very nicely if you don't 100% rely on. If like I don't think so. For it has been used for a long time for assignment checking, but there are a lot of things coming on the media that one of the professors remarked all of the students as they are AI generated, but actually they were not. So we need to make an ethical boundary, and we need to maintain our critical thinking how we are interacting with these large language models. As an educationist, it is a good as an assistant both to an educator and also to the students, but we need to take into consideration critical thinking, ethical aspects, and also verification of the sources, verification
Yeah.
of the references, you can say. So these are most important point. Without these, sometimes like you have also seen, it comes up with the fake references as well, and very confidently if you point out okay, these are not fake, these are not true references, so it accepts its mistake as well. And most of these hallucinations, they
But
call
if you
in the
point
AI
out,
language.
if you are aware of it,
Yes, yes.
otherwise it is harmful for the person
Other harm.
who doesn't
Yes.
know about that.
Yes, I came across a study where it actually one of a person, he was taking medical advice each and every day that I am getting weak, and he is taking some advice regarding hypertension as well. And later on, AI was asking it to use sodium bromide as a salt. So like sodium bromide is like when he taken, though in a small amount, when he taken it haven't has any effects, but later on this patient was facing the challenges of bromide poisoning. So once, especially for the medical advice and for these educational references, I can say we don't need to 100% rely on AI. Yes, for some laborious task, administrative task, maybe some sort of data analysis, that also is not 100%, but with our human judgment. But for healthcare purposes and for educational purposes, we need to verify the resources, and we need to maintain our own critical thinking. Use it as an assistant rather than as a supervisor. AI is not the one to instruct you, it's you actually who is the one to instruct AI.
Yeah, obviously. So if we talk about medical information, that is really harmful because it cannot replace the doctors or healthcare professionals. Indeed, symptoms are not provided as people feel. People are not aware that how to elaborate it to AI. AI would
Mhm.
give you information in very jiffy, without collecting all the symptoms or all the information. So it's like if you have less knowledge, that is really harmful. It's like in
Uh,
Urdu, Neem Hakim Khatrai Jan.
yes, yes, the same. Little knowledge is always a very dangerous thing. So, like for the medical information, what are the things, like I'll talk briefly, what are the things that can be taken over by AI, and what are the things that may be simplified with the use of AI, and what are the things that AI cannot replace. First, human and patient interaction, a doctor and patient interaction, AI can be used as a source to transcribe that information and put that information in logical notes. We have subjective assessment of this patient, a subjective or objective assessment of the patient. It can classify those notes very well. It can transcribe that notes very well, but it cannot take decision on its own. It can provide some recommendations, and that recommendation must be collaborated with a human being, with a human doctor, and then it can be used as a source of information. Second thing is what it can be used for. It can be used whenever we are dealing with, my job is mostly in the emergencies, but other departments, there are a lot of administrative tasks, like we need to talk to the administration people for stocks, for refillments, from pharmacy, certain things, or talking to the government stakeholders for provision of certain things. In that, AI can help us. What the things AI may be of some uses, with the advent of these genomics and precision medicine, AI can predict certain disease patterns ahead of time, taken into consideration these genomics, and still that field is being evolving. What are the things in the healthcare which AI can't take fully is the empathetic relationship of a doctor with a patient. So empathy is the core cornerstone of healthcare profession. That empathy cannot be given by a robot, though it can be a sympathetic sort of a relationship. When you interact with a large language model, it can be a bit sympathizer, but it cannot be that much empathetic, which a human being can understand emotions.
It
So
doesn't
that
have
thing
any
AI cannot
emotions.
replace.
It is emotionless.
Yes, so it is not that much emotion, like it is not that much empathetic, we can say. So empathy means that, like, it cannot put itself in the same situation. So it can sympathize with you, but it cannot be empathetic. So this is the thing which makes human in the loop always necessary for the health here. Now, talking about education sector, uh,
Yeah.
a few things. It can work very well as a peer collaborator, but that also in a constrained environment, when you are talking like for summarizing a research article, or extraction of data, or you can say with a student, making him prepare for the final exam, but that is relevant to some specific source. These things still need some critical thinking of a human brain to interact with these large language models. In education sector also, we cannot be 100% rely. Second thing, for language comprehension, understanding of a language, it can be used as a starting point. Suppose I don't understand French, but I may use it initially for some interaction toward translating a French language, but wholly solely I will not be relying on AI. So language comprehension, language acquisition, specifically talking of these language tests, it cannot be used 100%. Yes, it can be a sort of an assistant. It can be collaborator for 40 or 50%, you can say. Once you have enough interacted with these large language models, that you have trained it. Like, I maybe interact with the large language models in some other sense, you interact in some other sense. So your response of the large language model may be different from my response. So this is each and every day, once you interact in taking into consideration your own brain, your own uh, logical and critical thinking, then you come at a point where it can be helpful, but still it cannot replace 100%. And this is my thinking of the concept of, there is a concept, theoretical concept, that at one time AI will surpass human brain thinkers. They could call it a super AI, which according to me will not be possible. I don't think so. Will possible. Maybe people differ from my opinion, but I don't think so that it will. It can replace. We call in our language as ashraful makhluqat. Insan ek ashraful makhluqat, because we have that critical thinking. So it cannot replace. Yes, it can be used as an assistant to assist along with your work.
Yeah. You are right. Because of the knowledge, human is superior than other creature in the world.
Yes, because of this critical thinking, basically, human being is superior than other creatures.
Yeah, right. So if we talk about medical assistance, so that is indeed really harmful as we talked about. One thing I would like to mention that it's relevant to body weight, symptoms that what are you feeling, which symptoms are you facing. If you get help by AI, it would not instruct you as per the illness or the weakness. This is the doctor. If he or she examines you with his or her expertise, as you mentioned, relevant to emotions as well, and the experience of the doctor, physically or qualifications. So, doctors' enrollment is really mandatory. Otherwise, it is indeed really harmful, especially in medical assistance. If we
Uh,
talk about education, so we talked about that educationists or professionals like trainers or instructors of the languages, their enrollment is really mandatory if you get help relevant to education or to learn any language. They know as per their expertise or qualifications. They have more experience than AI. AI came right now, but human has been learning from ages. That
yes, you are right. Uh, the main thing which like I get is that it can be a sort of a collaborator with you, but it cannot wholly solely replace. And there are, like, when we talk about this general large language model like ChatGPT, Grok, even when you interact with and ask for any medical advice, it will prompt you at the end that I am a large language model. Better this thing uh, can be used just for a knowledge purpose, but not for an actual medical practice. There are a few advancements in AI where some specific models are built. Suppose there is Cure AI is for radiological imaging, and there is another model PGI that is for histopathological diagnosis. That are like more professional sort of image, but still that models also needs some human interaction. So basically, to give an idea, these radiological images like scans, they are being taken up by that large language model, and then it gives the findings, that what are these findings. But these findings need to be re-verified by a radiologist. Second, same is the case with the histopathological diagnosis. So it can be at times, like, it can sometimes it may miss some points which a human being can pick. Sometimes it picks few things which the human being may not pick that much, but like, yes, it gives some suggestion in that case.
yeah.
So it must be used as a collaborator rather than a whole model. Like when we have technological advancement, always whenever there is a new technologies coming, we always face two groups of people. One group of people, like the younger generation, they will say, yes, we need to 100% rely on AI has come, so it will do all everything and this and that, and they will be talking about much hype about it. And there is another group of people that will always be against the use of technology. Like if we go in the past, whenever a new technology came, people face such challenges. Now this is our responsibility, basically, to maintain a critical thinking at such a level that we need to take something in between both these aspects. Both groups are not 100% correct. Both groups are not 100% wrong. So we need to take some way in between both these views.
You have elaborated very well. So, sir, I would like to discuss about the topic. How are tech industries leading in this era of AI, and which steps are they taking for future advancement with AI? How do you see 2030?
Okay, so talking about, like, there's a lot of advancement in each and every field daily. There's a advancement. First of all, we have these general large language models. Then we have these large language integrated in our analysis tools such as Microsoft Word, Excel. Then we have AI integration in our daily tasks with Gmail, like for streamlining of the documents, replying of the emails. Then comes the era where we are currently are having a phase where agentic AI is there. Like agent has a purpose, and it is built for some specific task, and it thinks based on the already trained data and come up with a response in a more streamlined fashion. So talking about 2030, there will be a lot of advancements, and what I see that there will be a more human collaboration with machines. Robotic phase is coming as well, so we need to prepare it, but it will not take into account the thing that it will take whole of the 100% of the job.
Right. Dear audience, I hope that Dr. Rehan Yaqoob, an emergency physician, has elaborated all of the questions or relevant to AI very well. It's precisely perfect answers as he talked about, as per his knowledge, qualifications, or experience. So I hope that you have gained a lot of the knowledge and you are right now familiar with this technology that which things should be avoided and which things should be adopted by AI. It is beneficial, and on the other hand, it is harmful as well if we are not aware of that, or if we do use it in that way to be rely on it totally. So, as he talked about that human enrollment is really mandatory by using AI. It is indeed really fruitful if we use it technically, especially if we do have critical thinking. So we can get numerous of the advantages, whether it's health, education, or if we talk about any daily tasks, or to make any assignments, or to use it in any way to make our work interesting or useful. So I hope that is really beneficial to you. Wish you all the best. You would see me with another foreigner or educationist or professional in future with any other topic soon. So till you may subscribe my YouTube channel or follow my accounts on social media like LinkedIn, Facebook, Instagram, and I would like to have Dr. Rehan Yaqoob if he wants to give any message to our audience.
Thank you very much again for inviting me to your podcast, and it was a very fruitful discussion on what AI was and what is in the future. Like my message is to each and everyone in every field is just to be aware of the technological advancements, maintain an ethical like an ethical framework in your mind, that how you can integrate these artificial intelligence tools in your professional and everyday life. Uh, we need to interact with these, because if you don't interact with, you may left behind. So if you have used AI for certain purpose, be transparent about it, be take about the logical and ethical aspects of your organization where you are working and the field in which you are working. So do interact with these large language, study these tools on your own. There's a lot of take help from your peers, talk with some expert as well, but don't over rely on these AI tools. So maintain your critical thinking, use it as a student along with you, as your friend, or you can say as your assistant, but don't over rely on these AI tools.
Mhm. Okay, sir. Very well elaborated. I would like to appreciate it again. The time which you have given us, it's really precious, and we are really pleased to have you for this fruitful discussion. If you want to give your reference to, if the audience wants to approach you, so you may. The floor is yours.
Yes, yes, you can approach me at my LinkedIn. We will put that uh, in the podcast in the comments section. So, if anybody is having any difficulty regarding the use of AI in their own particular field, in scientific research, or in the integration of artificial intelligence in healthcare, or as an educationist, they can definitely interact with me, and they can approach me at my email address. This is Rehan Yaqoob at gmail.com, and I will also put my LinkedIn address so they can interact with me.
Surely, inshallah, they would.
Sure.
Okay, sir. Once again, we are really pleased to have you. Thank you so
Uh,
much.
you are welcome, and it's been a very nice discussion. And keep up the good work for future podcasts as well.
Same here. Inshallah.
Sure.
Okay, Lafis.